This is the typical left convex, right thoracic convex. Now, remember, the muscles on the outside of the curve are firing off consistently. The muscles inside of the curve need to be stretched. So what we would do sometimes, okay, is to pass a small vibration, and what this is just a converted jigsaw, at 10 cycles a second in the concave portion. And just for a few moments, okay, not for very long, because what that's going to do, that's 10 cycles a second, relaxes the ligaments. And once those ligaments are relaxed, it allows us to distract the body even more. So on this, we would contact the convex portion. We would separate the joint. I would grab one of the legs, the extremities, separate the joint, laterally flex in to the curve, and do a pumping action. So we distract the joint, laterally flex, until we start to feel a change of the paravertebrals. And then, using the equation, force equals mass times acceleration, at the apex of that, we're going to do a drop in this direction, causing inflammation at the disc, because inflammation is how the body's going to regenerate. We would also do the same distraction at the thoracic area, where we would distract down, contact in, and flex out. Flex into the convexity, applying pressure in this direction. When we feel those paravertebrals change in tone, then we can also do the drop in that direction, causing the inflammation of the disc, changing how the muscles fire off, because that's all changing proprioception. You can only correct the scoliosis by changing how the brain views the body. In addition to which, you want to increase the curve, the lordotic curve of the lumbar, so you're going to contact on both sides of the paravertebral. Maintain it just for a moment, because by maintaining pressure on these joints, you're going to feel the paravertebrals change in tone. Why? Because you're applying pressure on the facet joints, and those facet joints, if they're open, they're going to increase the tone of the intrinsic muscles of the spine along with the paravertebrals. So if you just maintain pressure there just for a moment, you're going to feel the muscles fluctuate. Then you're going to set and do a drop just in that direction, okay, increasing the curve. The same that you would on the cervical, you can also do a drop where you're going to increase the curve, because remember, in a scoliosis, there's less of a curve of the spine. So you're going to set this, contact at the apex, backing up, okay, your contact, a contact on the articulating pillars, and driving straight in. Okay, that'll increase the lordotic curve. Now for the exercises, what this patient is going to be asked to do is they're going to be asked to lay on a rolled up towel for 20 minutes at the apex of the curve. Now we want their head supported. We want them to be comfortable, but knowing that anyone with a scoliosis is going to have an uncomfortable pelvis. The pelvis is going to be unstable. We want them to have a pillow in between their legs as well. And they're going to lay like this for at least 20 minutes. Why? Because for human tissue to cross that plastic elastic deformation curve, they have to be under consistent pressure for 18 minutes. If it's a thoracic curve, it's going to be the same. But we want their head supported. We want the pelvis stabilized by having a pillow in between the legs. And they're going to do this at least daily. Only on days they want to feel better. Okay, that's what I tell them. Okay? Now, let's work on Tabitha. Okay, so Russell, you can shoot that.